Now, call this meeting to order, August 31st, 2022, Finance Committee. Okay, are there any changes to the agenda? Okay, I'm hearing none. Then the agenda stands where it is. Approval of the minutes from the July 27th meeting. We don't even need a motion if no one, if there's no corrections, the minutes are approved as they stand. Public comment. Is there anyone from the public here that wants to make a comment? It's time you can get a couple minutes to say whatever you feel like. No? I see somebody behind that one phone down there sticking his head out a little bit. But no, I guess not. Financial statement. Dave, I think that would be you.
Thank you, Gene. I'll take over. And we're going to go to page 8 of the packet, the statistics, and we're off and running on a new fiscal year, July, first month of the new fiscal 23. We're going to start out looking at the two statistics, line item 8 and 9. We're a little bit down on acute, 97 compared to the budget of 134. If you recall, last July was a real busy summer. We had 155, so this is more of an average acute number here, although even a little bit lower in budget. But conversely, we had a lot more swing than we had a year ago. We only had 13 swing beds, and that's up to 47. So that helped a little bit on the revenue side. Going down to a little bit lower ER, the number for moving this down. I've got a new software for PDF, and there's a way to trigger, here it is right there, I believe, trigger the down arrow, and I thought I had it figured out earlier today, and now it's not working.
Can you grab the arrow off to the right over there?
There it is, yeah. Okay.
So
the ER, which is line 34, 30 total ER visits is 32. The 664 compares favorably to the budget and last year. So we continue to grow in our utilization of the ER. So that's a good thing. That's a big part of the outpatient business, because when they're in the ER, that means other services like pharmacy and CT and other departments are also busier.
August appears to be trending the same way.
Yes.
Yeah.
Things really do look up in a lot of categories for the new fiscal year. Clinic was up as well, compared to last year at least. The 1291, we had 1157 last year. So clinic continues to be very busy. And that's despite the fact that we don't have a full set of practitioners that we need. So I'm sure they're really challenged over there with a combination of not.
Is that COVID visits also, is that all last year?
Well, this is the month of July, and I don't know, Mark, the COVID people don't go to the clinic. They go to the ER, right?
Well, we were doing a lot of stuff for them through the clinic, I think.
I see. Yeah,
Okay.
I'm not real sure on that. FTEs are down a little bit compared to last year, which is a good thing. So I'm going to move into the next page. And we're going to go a couple pages up. I'm just going to briefly touch on the adjusted strength graph, which continues to look real strong. The new number 3.48, as you can see, is still very good. Now, what I wanted to do is spend the rest of the time spending it on the new graphs that I created on the next page, because just for an example, if you want to look at adjusted financial strength index number, which is 3.48, it's kind of helpful to put that in a context of how does that compare to previous months recently. And you can see we had our big run up last year of our strength index going up, finishing the year at 3.77. So it did go down a little bit to 3.48 in relative context. It's real good, but it's not quite as high as it was a month ago. Similarly, if we look at ER visits, we can see that that number, this is 664 actually, so that's a improved number. The skilled nursing is actually the correct number, is a little bit down from the 1519. So I have to fix this graph. I thought I had a more recent one there, but the trend on skilled nursing has been going up, but it's kind of leveling off again. We talked about acute being lower. Now this should be 97, not 155. This is the combined swing bed. So the real number is kind of in the middle, but it's certainly better than it was last month. In June was really slow and acute. So the other thing I want to compare is I want to talk about this last graph that doesn't really mean anything right now because it only has one bar, but you're likely to see on this graph a situation where we're sometimes positive, greater than zero, and sometimes negative, where we don't hit our cash targets for a given month. Why this is important to me and should be important to all of us is that's really a good measurement of our success or failure, is whether or not we're generating enough cash to keep us on track to have a sufficient amount of liquidity as we move forward on the seismic project. And as if we continue to exceed our estimates on cash, we should be in good shape as we move into the next 7 years of much higher spending to give us confidence that yes, in fact, we should have enough money. So that 393,346 represents the difference between where we think we're going to finish at the end of this year compared to what's in the budget, based on all the activity and the detail that happened in the month of July. Some numbers were higher, some numbers were lower, but it netted out that we're in a little better cash position projected for year end than when we approved the budget. So far so good on that particular number.
Did you take that position out of those numbers? We talked about that.
I'm sorry, I don't know what your question is.
You don't?
I didn't. What was I supposed to take out?
The marketing position?
Oh, that's still considered budgeted expense. So the cash projection assumes that if we don't spend it on that particular position, we'll spend it somewhere else because the board approved it. It's just an assumption. It doesn't mean that it'll have to happen that way. But the way I do my projections is I combine actual information with budget to come up with a projected year-end number. So as of right now, these cash projections do assume everything that got approved in the budget will get spent.
Okay, well, it makes us look 100,000 better than when I made the motion to approve it. That was supposed to be out of there. But
yeah, so if we don't spend it at all, then we'll even be even higher than what I'm showing.
Okay, all right, thank you.
The next quick line item, which is favorable, is the reduction 1.1 million on line 4, gross patient receivables went down from 27,922 down to 26,761. So we continue to make progress in getting our AR down. The next page I want to touch on is the income statement for the month. And I wanted to start out with just a general comment about, and I said this before and I'm going to repeat it a couple more times and try to explain why. We intentionally did something this year that I don't always do, but because one of our big goals is to make sure that we are financially secure as it relates to the desired completion of the seismic project. I did a lot of calculations over the next 7 years to try to figure out whether we were good shape or not to be able to still have enough money left over for all 7 years of the expenditures for the 20 million that's required. So part of that causes the calculations where you have to back up into the current year that's being budgeted and ask yourself the question, how do we have to perform each year from operations in terms of cash flow in order to achieve the objectives of having a safe level of reserves at the end of that period? So because we have such a ambitious goal of getting this all done without any more borrowing, it kind of raised the bar in terms of what I felt we needed in the budget for the year. So the annualized budget that got approved last month was close to $4 million. That compares to what Chet put in last year was 700,000. So that's a huge difference in the bar that we're setting on the budget column. So for example, one of my points is, should we feel bad that this month we missed budget? Well, maybe not so much if you really look at the fact that the budget of 335,000 is about half of what the budget was for the whole year last year of 700,000. So we have a very high bar we're trying to hit every month. So it's probably more reasonable, if you're going to have sentiments one way or the other on how we're doing financially, is to just ask yourself the question, well, 265,000 bottom line is still a healthy bottom line. We might not have hit Dave's target based on his stretch goals of making sure we have enough for the seismic, but at least we're operating profitably with a fairly good percentage margin, and those kind of things are the other indicators are all looking good. The financial index, strength index, looks good, but despite all that, we didn't hit budget. We missed budget by 69,000. So I wanted to kind of just give you that context, because it's going to be the same theme all year. We're probably going to have a lot of good months, but despite that, we won't hit the budgeted numbers. So does that make sense?
Dave, do you think that will balance out over the year as we start to get?
Good point. What's really going to matter?
Those big balloon payments?
Yeah, what's really going to matter is exactly correct. The IGTs, if they come in as expected, we should be in good shape. But you'll see it later when we get to the bottom of the next page. We had an IGT of 0 for the month of July. So until those dollars start coming in, we have to be careful and not to show any of that on the bottom line until we actually see the money. There are a lot of examples and circumstances where the state changes the timing of when they send out payments, and then all of a sudden you put it in the budget, and then it comes a month or two later into the following fiscal year, and it makes you look like you didn't perform well against budget when it had more to do with the timing of the state than anything else. So, but that's a good question. We are likely to, if we in fact do have some really big checks that come in later in the fiscal year, it should cause these numbers to flip to be better than budget.
Dave, about 20 years ago, I know it's a long time, we were basically bankrupt. Oshpod gave us a loan and required us to hire Chet to be extremely cautious or conservative.
Mm-hmm. Yeah.
Now, how far off from what he was required are you being a little?
I'm probably being a little bit pessimistic like he is. That's what CFOs do, because we don't want to, because once the money's spent, it's gone, and then the results are not good in terms of the consequences of having a hospital in distress. none of us want to come even close to that. So yes, we are, by setting the budget the way we did, we are being conservative.
Okay.
But I don't believe some of the conservatism that I seen with Chad. I don't think I'm quite that far
Well, that's why,
that way.
that's why
But
it's important us to have him. And we've hit some rough spots while he's been here, even with him being conservative.
So one of the big things that we can look at is how are we managing our expenses and costs? And that's a favorable number, 1.53 favorable variance total operating expenses in the month of July. Some of the numbers that were much higher than budget is not a problem, because some of it's just the timing of the way they invoice us. For example, for insurance, we budgeted 1/12 of the total insurance. So what happens every year, I think it's Alliant, one of the, or maybe it's Beta, that front loads their required payments. And so Barbara ends up expensing a little bit more in that month. So for example, you can look to see what it was a year ago on insurance, and we're right in the same ballpark, 83,000 versus 86,000 on line 22 for insurance expense. So we're not concerned about that particular line item being a problem on terms of managing our costs. It's just more of a function of the budget being set out at 1/12 of the amount that got approved. So that's salaries and wages. Obviously, the labor continues to be a important part of managing costs, and we did a good job, 5% under budget on the labor costs. We do have some issues that we want to deal with, and I'll be giving updates on the retention credit, because we can kind of hurt ourselves by being too cautious on salaries and starting to lose good employees if we're not paying them enough. So I think that number is likely to change if once we really think about the cause and effect. And if, in fact, if we get some more COVID money for retention credit, which I got a call today and they're making good progress. They've taken it to the next step in terms of approval. We don't have 100% assurance yet, but that would be part of the money that we could apply to more salaries and wages if we do some kind of a upfront bonus to create a situation where we have less of a risk of losing good employees is something we probably need to be more concerned about than whether we hit our under budget on this line item for salaries and wages. Is probably more important that we don't lose good people. So I'm just kind of giving you the trade-off on how it works when you're trying to run an organization and you want good quality, but at the same time you want to be running it fiscally responsibly. So it's always going to be a trade-off like that.
The other nice thing about having the salaries and wages affected is you decrease your contract labor cost.
Yes,
Yep.
Good point. So the one thing we did fix in the budget this year, Chet, was higher all last year. We did a lot of number crunching, and you can see we nailed it by $265. I figured out exactly what to put in there for fringe benefits. So we got a much more accurate budget this year on fringe benefits. So I felt pretty good looking at the way we budgeted. This was my first budget, and it looks like it's going to be pretty accurate in terms of what we should expect. So I didn't see any numbers jump out at me as being inappropriate. We do have, like Mark pointed out, an issue going on with contract labor, 27,000 over budget, and that's going to continue to be an issue all year.
Hey, Dave,
Yes.
sorry to interrupt. Hey, Gene, I'm going to drop out now that I see Catherine's online. So
Okay.
she's
Thank you.
taking over.
Thanks, Ross. Catherine, Ross. has been
Thank you,
public-
Ross.
Okay, so we're going to talk a little bit about another big number on the month of July, line item 30, 167,530. That's the estimate of how much we're bringing in on all the money that's set on the balance sheet that's still out there as a payable. We estimated about 2 million will be as a result of us sending in reports all year long we'll have that much more confidence that we'll be able to show some more of that to the bottom line. So every month, we're going to see about 160, 170,000 show up on this line item, which represents a bringing it in from the payables of what Chet had been concerned about, whether or not all those COVID payments, stimulus payments, we're going to be able to keep. Once in a while, I'll have a report that's due to the HHS. I'll copy Tim on it, and it's a very involved report that requires us to justify the COVID expenses that we spent that COVID money on legitimate COVID related non-reimbursed expenses. And so far we've been successful in showing that, and we don't have any reason to think we will continue to be that way and not have to pay any of that money back. So the good part about all that, it shows up on our bottom line when we get to add it to the non-operating revenue on line 30. To be fair, we put it in the budget so we don't look like we're doing that well compared to budget. We know it's budgeted numbers, and it is coming in like we thought it would. But the reason I took the time is because the numbers are so high, and it's an important part of our bottom line.
Hey, Dave, I have a question on line 31. Income derived from property taxes. Is that a monthly number?
Yeah, that number is about what we average every month. You can see it was 23,000 last year in the month of July.
Okay.
It does vary from month to month. It's not always this high, but it's pretty consistent. So you multiply that times 12, so we got about 400 or so thousand that we also, the Kern County sends us money because we're a district hospital, and that comes in Prop 13, some of the Prop 13 money. Obviously, that number would have been a lot bigger if we would have got the partial tax approved. But in the absence of that, we still get a little bit of tax money that does come in. The other thing we were talking about earlier, one of the reasons why the bottom line not any higher monthly IGT payments for July, it was 0. So that we don't have anything to help us put more on the bottom line for that. The next thing I wanted to talk about was the trend. Looking at the 13-month trend, we have a situation where we can ask ourselves the question, so how busy were we in July, and how does that compare to prior months? Well, you can see the month of June, our gross charges on line 6 was only 8.9 million. And you can see the jump up, went up quite a bit in July to 10,373,000 on the revenue side. So that shows a busier month. Now what you have to do is the 7% rate increase kicks in every year on July 1. So you have to ask yourself the question, if this June numbers had 7% higher rates, that equates to like 9.6 million. So that still shows about a 700,000 improvement adjusted for the rate increase over the month of June. So we're hoping that the slump that we had ending last fiscal year would turn around quickly, and hopefully the July and I think August is also showing that we are now heading on the way back up again. So that's a favorable trend that we'd like to see. Move down a little bit here, and I have my notes. I circled another line item that might be a little bit of a concern, and I was going to research it, and I did not get the detail. Something happened in supplies. You can see I'm struggling with this, managing this. So the supplies went up from 310 up to 405. So I'll have to take a close look at that. I'll report that at the full board meeting of exactly what that was, why we had such an increase in our supply expense compared to the prior month. So that's all I had for that.
Stuff's made out of copper.
Yeah, we're finding out, that's a big part of our problem with the seismic project is that the first bid we got had to do with the copper
Yep.
costs. So the next thing is just the AR page. And we're going to go down right there to, and you'll see the improvements that are happening in accounts receivable. A lot of different payers went down. Medi-Cal, senior HMO are really starting to come down. They were over 5 million, now they're in the 3 million. So that was getting ridiculous how slow the Medicare Advantage HMOs were paying us. Debbie's doing a good job of making calls, getting appeals paid, and bringing some of those numbers down from the managed care companies that Gene sells those plans, and we don't want to have to complain about their service, and they are starting to do better.
I saw the ones that pay though.
Yeah, they do get paid. So most of the payers did come down in the month of July, and also had a meeting today, and August looks even better. The total AR dropped from 91 down to 84 days in AR. So the last thing I was going to talk about is showing you how I changed 1 through 10 here. I moved up the items based on that article by Whitfley that I think was emailed to you, and we'll discuss that more at the full board meeting. It's the title of the article is called Critical Access Hospitals Top 10 Key Financial Indicators by Jeffrey M. Johnson, CPA partner at Whitfley. This is a good article, except it's from 2015. So what I had to do is I had to then find another article that had those same medians updated for a more recent number. And I did find one to 2020 standards, and I put those new amounts right here that compare on how critical access hospitals average on each of these ratios. Besides changing the order and putting the top 10 on top of this page, I also color coded it such that if it was red, that means we're not performing up to standards as it relates to critical access averages. If it's green, it means we exceeded those averages. Thankfully, the ones on top, which are the most important, are mostly all green. The third one, it's actually number 2 here. I had a 1A and 1B because there's different ways we can count days of cash. And you can see there's a big difference between the way we have historically showed days of cash and how we can do all cash sources up to 300 days, which is should help us when we submit certain reports to the on the bank covenants that will continue to be well above their requirements and not have a problem because of our liquidity. But the third one here is the one that is why we're addressing our overall plant situation by the master project, because our average days, our average age of plant is we just haven't kept up because we had a lot of bad years in the teens and didn't have the money to spend on the plant, and now we're doing some catch up. Well, that causes this number to be red, that we really haven't spent enough money on construction historically, and that's why the average is 11.58, the lower the better, and we're at 14.21. We do have the reason why number 3 is red is what capitalization means. It means your historical bottom line going way back since the beginning of time. And because this organization has had a lot of bad years, before the last 3 or 4, your capitalization, your total assets on your balance sheet is not a real high number. So even though you don't have a lot of long-term debt, your capitalization, which is the net worth of the organization, which is the cumulative profits over the years, is also a very low number. And so that's why that ratio doesn't turn out very good, because of the many years where we weren't performing very well, bottom line. So any questions or comments on this page? I don't really like how it turned out. It's too hard to read, so I'm probably going to change that color coding. Didn't really work out like I hoped it would. The last thing I want to talk about, there's only really one number on this cash flow page that at this stage means anything to me, and it has to do with the comparison of what the projected cash is by the end of the year, which is the far right column, second column to the far right, projected 23. That's where we think we're going to finish the year. What I want to see every month is I want to see that number compared to where we thought we were going to be. And so I look at line 52, and what I see here is I see that our new projected cash number is 24,946,000. What's in the budget is 24,553,000. So right now I'm feeling pretty good that we're on track to keep ourselves positioned well to continue to move forward with the construction project based on the estimates and the assumptions that we've made so far. Now, granted, that could change once we get the new estimates in from the bid. The company that got the bid will be giving us an update on how close we are on the estimates. We found out recently that the copper prices are way up, but that can go way up and down too in a year or two. You never know on all these different moving targets. So that's my report there. Do I move right into the next agenda as it relates to the IT expenses, or?
Can I ask you a question about your report there? Are you trying to confuse some of us or all of us?
I have a lot of numbers here because I want to make sure, because I'm new, I want to make sure I give you accurate information.
You're doing good. I was joking because it's pretty complicated. I understand every number.
You can, it obviously gives you a chance to challenge any of these numbers if they are not accurate. So I'm opening myself up for a lot of questions, but it truly does. My goal when I came here is it's like a mechanic. A good mechanic really knows how all the gears turn in a car and how everything affects something else. So that's kind of what a CFO does, is they get in there under the hood and really look at all the moving parts to see what's going on. And then
good. I was joking, Dave.
So that's the important things to me. Is I think we're in good shape. Again, I wanted to emphasize that it could be a common theme that we don't hit budget, but that shouldn't necessarily be a reason for a negative sentiment on any of our parts on how well we're doing financially. I think the numbers speak for themselves when we look at certain ratios like the financial strength index, and those types of ratios probably mean more than whether or not we hit budget. So thank you for your comments. And Heidi, do we move right into the IT analysis, or?
That's later on the agenda. We have some other business to take care of first.
So I will stop on this section.
Okay, so then Barbara, you're online, right, for the local vendors?
Yes. Are there any questions? You can see that they're all current.
Well, the one question is on Scott Nave, does that change we pay him separately for what he doesn't, we pay him a certain amount for attending meetings. Has the hourly amount gone up or down, or does it stay about the same? Or would it come to the board if we increase it?
I'm sorry, I couldn't understand.
His hourly wages, Dave's, or Scott?
I don't believe they've changed, have they, Heidi?
They've not changed in quite some time. But that's
Okay.
on the contracts list. We
Okay.
were doing
Well-
local vendors.
Right, but if it did change, we would be aware of it, right?
Absolutely.
Oh, yeah, yeah.
Okay.
Oh, the retainer fee? No, that has not changed.
Well, not
Correct.
the retainer fee, his hourly wage.
The hourly rate has not changed either.
No, no, nothing has changed.
Okay, thank you.
Did you have questions on the local vendors?
No, everything else looked good to me. Catherine?
Did you
No,
have any?
I
Oh.
don't have any issues. Thank you, Barbara.
Sorry.
All right.
Is there any questions on any of the other contracts or agreements listed?
No.
No,
Okay,
Okay, thanks, Barbara.
you're welcome.
Okay, next.
Did you
Capital.
want to send the
expenditure.
contracts to consent?
Oh, I'm sorry. Yes, we'll send that to consent. Right, Catherine? We couldn't hear you, but I could see you say yes.
oh, you can't hear me?
Now we can hear you.
Okay,
Thanks. Okay, next is the capital expenditure request for a cell washer for blood bank. Who is that now? That's
That's
Rebecca
Rebecca.
Martin.
Rebecca.
So on that capital request there, the justification on the first page is incorrect. I apologize for that. I was using a template. The justification is on the second page, and it's basically the one that we currently have is just a spinner now. It doesn't even wash cells. We hand wash. This particular cell washer is, I want to say, close to 20 years old. It still works good for the spin cycle. It may possibly be able to be fixed, but we can't do that without something. And so just replacing it with a new one is kind of the best solution, and taking that old one. And if we can get it fixed, good. If we can't, we can still use it because we can still hand wash in the new build laboratory.
Which one? There's several bids in here.
It's the first one, the Fisher one, the less expensive, the one listed at top.
7,000 or so.
And I think I budgeted 8.
Right, that looks good to me. I looked at it a little bit. Catherine?
yeah, are we going with that one because of the price, or do you feel like that one is going to be adequate?
It is the price, it's adequate, and also the Fisher vendor is much more reliable than the others. And it's the cell washers are pretty much all, other than the one quote that I got that was astronomically high, and I have no idea what bells and whistles it has on it or why it's so high, but they're pretty much the same. So it's a company I like doing business with because stuff shows up.
Okay. No other questions for me?
Okay, then we'll send it to consent.
Yes.
Thank you.
Okay.
I'm good.
Tim, were you gonna say something?
Yeah, I know, I'm good with that too.
Okay. I can't do two things at once here. Hold on one second. Capital expenditure for the 340B TPA provider rainwear Sentry. I don't know what that is.
You're
Who's doing
not
that?
here.
He's gonna tell you.
Oh, this is our
Suda and Tiffany, this is your show.
Go ahead, take over. Suda or Tiffany?
Suda's on
Tiffany,
mute.
you're on mute. We can't hear you, Tiffany.
Suda.
So Jean, do you know about the 340B program?
I don't know anything about it. I just take normal medication.
Okay, well then hopefully we can onboard you onto our 340B program when it comes in. So what it does is it's highly regulated, and you have to be compliant to the nth degree in order to actually participate in the 340B program. It's where we will get drugs, and I've given a few examples here, literally for pennies if you're within this program. And then you still get paid relatively the same amount from commercial insurances. So the actual difference between what your costs are and what you'll actually gain from it, it's so large. It's crazy how they do it. The reason that they're offering this is so that the monies that you save, they can be used for other needs within the hospital, and to, if you have other areas that you want to develop. So it's a very profitable program to onboard, and it saves the hospital. We don't have to pay high costs for drugs. We pay a much lower cost in comparison to retail. So I did sort of a quick breakdown. So for retail, our difference would be, if we were to process these prescriptions through retail, you'd probably make about maybe $20-30 per prescription, dependent on what it is. But for here, you could be making literally hundreds of dollars compared to $20-30. So
Sudha, can you give just a couple of examples of the price
yeah,
differences?
so I did a quick breakdown. So say we have Eliquis in the Eliquis 5 milligram tablets. We purchase them for $15. Through 340B, we'll get paid $241 for the Eliquis 500 milligrams for 5 milligrams. So it gives you a profit of $226 for that particular one. The retail cost to purchase this is $492, and the insurance will pay you $528. So you'll only make $35 from it. So with retail, you'll make $35. In 340B, you'll make $226. And that's one item, that's one drug that one patient might take. So if you roll this out, we're currently using it for SNF, and that's the way that we're sustaining SNF, by having this. Otherwise, it would be very costly. So if you roll this program out throughout the hospital, throughout your ER department, throughout your acute and through your clinics, and it's very detailed, you have to check all your boxes correctly to make sure that you've onboarded everyone properly. But if you're able to roll this out, it would just, this could really be very profitable for the organization. I'm surprised that it hasn't been
Catherine?
onboarded into its full, capacity. So something like this, it's very hard to get into 340B. It's very hard to have a pharmacy which is working within a hospital to be able to process prescriptions for all patients through the 340B program. So this is an opportunity that, if you have something like this in the real world, it would be, wow, you got a 340B program and you got a pharmacy. It could work really well.
So give an explanation too, like on qualifications, because it's a little unique. It's the facility has to qualify.
So it's an intense process, and all the patients and the facility has to be registered with HRSA. So the hospital has to be registered with HRSA. The clinics have to be registered with HRSA. So the hospital would be the main entity, the parent entity, and then the Mountain View Clinic would be the child underneath it. The outpatient pharmacy, we would be aligned with the hospital as a shipping address. So we have to be onboarded as well. But when you actually process a prescription, it goes through an intense checking process. It's not the same as a retail prescription where we'll just fill it and the insurances will pay us. Here, we have to have extreme due diligence through our software, which a third-party administrator is going to monitor for us and make sure that all the claims that are adjudicated, they are real claims and they are for 340B patients that have been seen by 340B facility. So the patient has to be seen on Kern Valley grounds at the hospital or at Mountain View with a prescriber that is actually on the hospital grounds. So all these checks have to be done, and the third-party administrators, they have all these checks in the software that we want to onboard. So that would, obviously they're going to charge for it, but if you think about the cost and what you're going to gain from it, it is really large. So there's a whole lot of checks that have to be done for the patient at the end point. And before we even start the program, you have to make sure you're compliant. You have to have all your workflows in place. You have to have your policy and procedures in place. So it's intense, but it would be worth the effort.
Catherine, I can't see how we could not do it. Does anyone have any questions?
No, one other comment I just wanted to make, Sudha or Tiffany, either one of you, is just a comment about the impact on the inventory. Because we've been in 340B for a while, but like you said, it's only been done for SNF. The issues there is under the old scenario, we had to provide separate inventories of drugs for the SNF and for anything that's on 340B, as well as the regular patients that we're charging.
That's
The new under this scenario with the third-party administrator, they have the ability to do this with a what do you call it?
It's virtual, so it's a virtual inventory. So we don't need the space to hold two physical inventories. They will, as we adjudicate a claim, they can decide whether it's a 340B drug they should charge to, or whether it's a regular retail. So that's all handled virtually. So we don't need to have, stock segregated.
So you'll see a reduction in inventory.
Oh, yes, yeah.
Is the costs going down dramatically as well. So
absolutely,
you get a dual hit there, positive hit to us.
Yes, yeah. I mean, just for instance, insulin, we have so many patients on insulins, and on 340B program, we get them at a discounted rate, literally for pennies. But when we process the 340B prescriptions, we actually get paid literally the same amount. So you'd still get a couple of $100, depending on what it is. So it's something, it's an opportunity. But as I said, if you don't have the correct software, you don't have the correct consultants that assist you to set everything up, really well, so that from day one, the system and the workflow are going to work, seamlessly, and that you're compliant. As long as they set everything up really well, there shouldn't be a problem. But you do need somebody dedicated to oversee it. Potentially, this could be, and I don't want to sort of mislead anyone, but if this was my pharmacy and I had this opportunity, I would have onboarded it by now. 340B. It's a good program.
And in the event that you're off for a week or 2 weeks, is it easy to maintain it while you're not there? It sounds like you're on top of everything.
Oh, Jean, yes, I sort of, I decided that I was going to commit to the post, so I'm here most of the time. When I work from home, it's either if there's something serious that I need to be at home for, but most of the time I'm here. I actually enjoy working here. So yeah, it's it works in well.
Okay.
I don't need to go home and cook for everyone. I've got my own time, so.
I hope you're here for a long time. You're the way you look at things and do it is really awesome.
Yeah, I'd like to think, yeah. But I even within the pharmacy, and I don't want to take away from 340B, but I'd hope that within a year you could see the difference that it's going to make. And then if we can sort of onboard as everyone on the clinic, the acute, the ER, and take the consultant's advice and guidance, because they're the ones that have the knowledge, they're the experts. Yes, you have to pay for their services, but as I said, you think about the gains that you'll receive from it. It's a good program.
Cool. Could I buy half of your accent?
That's going to cost you. It depends. Yes, you can, absolutely. Actually, you're next door, aren't you, Jean? I've seen you.
Yeah, I see you get out of your car once in a while. Okay.
Yeah.
I think 100%. Catherine sent it consent, right?
Yes,
Comment?
I just have one question. Are there annual recertifications on this program, if I recall?
Yes. We just
Okay.
finished doing it the other day. So,
Okay. And is that like very time consuming, or would it be easier, I guess I would say, with different software or programs?
Yeah, this is Dave. I just completed it, the most recent one. It is very time consuming. And I'm so glad we have Sudha here, because in the future, I am going to rely on her a lot more, because she is our expert on this program. But I'm going up the learning curve, and because it's a lot of bureaucracy.
No, there is, but that's why, and David, sorry, I have to correct you. I'm not an expert on all the compliance and the registrations and the licensing. That's why I said, if you have the correct consultants, sort of, you know, Sentry, Omnicell, there's quite a few out there. If you have them to assist you for the first few years, you know, you wouldn't need them, you know, further down the road as consultants. You'd have everything set up. But in the initial stages, it's best to get the advice and do it. And you have to think Sentry is a very large company, you know, they're a very large organization and they're desperate to get our business. So there must be something in it, you know, yeah. So, but I would take the advice and the guidance in the initial stages from the experts, just so that you know that you've set everything up well, and then we can just run with it after that.
Okay,
Okay.
we're gonna send it to consent. Thank you. very much.
Absolutely. Thank you.
Okay, thank you. Appreciate that, Jean.
Okay, next is, I think, Carrie.
It is me.
Carrie's next with the work data migration.
Yeah, so last month, the board approved the change in pharmacy systems from what is RX30 now to the new pharmacy system QS1. We have to migrate the data from RX30 to QS1. And that's exactly what this is. We're going to take all of the patient data, scanned images, everything that's on RX30. We're going to pay somebody to move it over to QS1. In full transparency, we could absolutely keep RX30. We could go back in there, pull this stuff up, but that has been done before with the previous pharmacy system, and it's always problematic.
Okay.
Primarily because, well, I mean, I could talk if you just want
What's
to
the
guess.
cost? What's the cost on it?
$6,000, one-time
Okay.
cost.
We can't afford to not do it, as far as I'm concerned. Catherine, or does anyone else have any comments?
I agree with you. Jean.
Yeah, I agree, especially if it's gonna stop some problems or even issues we would have farther down the line. But Carrie, you're starting to make it, you know, a reoccurring event for you to show up and ask for money.
Yeah, it'll happen here and there.
But just like technology sometimes.
Like
I
I said,
know.
this is
Full
true.
on.
When I have the current health systems board meetings, our IT, the VP for information technologies down there is in front of the board all the time with capital, and they're obviously much bigger dollars. But yeah, it's just there's a lot of stuff that goes into IT. I mean, it affects
Everything
department.
changes. Yeah.
IT's making us a lot of money too. So what he's asking for, in this case, is cheap. And
Yeah.
most of what he does makes us more money than what we're paying for, if that makes sense.
Yeah.
Well, I hope you're right.
Send it to consent, Catherine.
Yes, I would send it to consent.
Okay, any other comments? Okay. Consented, Carrie. Capital request for human resource information system. That's,
Gonna be Carrie and Sarah.
I'll go ahead and start. I have some notes that I kind of just want to go over in regards to the human resource information system. Currently, human resources is running off 4 separate databases that we have to manually input data into with all unique reasons that we use them concurrently with each other. This means that every update from new hire to termination is done in 4 separate databases currently. Having an inclusive HR system would reduce us to 1 database, thus reducing the likelihood of clerical errors and creating a more efficient means to seeing and correcting mistakes, inputting data, and having everything located and available to access in one spot. In addition to these 4 databases, we also keep multiple spreadsheets and Word documents for different purposes, such as our position controls, vaccination statuses, wage increases, term trends, so on and so forth, several other ones that we currently enter. We also have just 4 filing cabinets for our current employees and additional 4 filing cabinets, as well as storage units full of documents for current positions and terminated employments. And we're to the brim with our space, as well as filing cabinets to be able to put things into. We also have index cards that we use for every employee that we still manually use a typewriter to update information on, so that we don't have files for employees that have gone to the storage facility that we no longer have access to because we just don't have room filing cabinets for years upon years, so that we have somewhere we can at least have, pay amounts, hire and term dates and so forth. I did several meetings with multiple companies, and we've kind of narrowed it down to, I think I did about 7 different companies, and we've narrowed it down to 2 companies that we felt that had great potential for KVHD. The system that we decided ultimately had the best user-friendly in appearance and functionality was a system called PrimePay. They have built-in position controls, which keeps previous data to refer to as needed without the need to manage or store multiple Excel spreadsheets. They have a built-in turnover, hire and term report, which can be sorted multiple ways by data, reasons, departments, etc. They have an interactive organizational chart, which creates updates and stores past data when primary positions are open and occupied or changed. They have digital onboarding, which allows prospective employees to sign all new hired documentations on their own time prior to coming into the HR building. Currently, we spend 2 to 3 hours per employee for onboarding, not to mention having to review all of the documentation that's required and have them manually sign it all in front of us in the HR office. Currently, the new hire packet, physicals and drug testing, like I said, is a minimum of 3 hours, depending on how quickly we get through it. Sometimes we can onboard 2 to 3 employees a week, and we're spending, that's 9 to 12 hours that week just onboarding 3 employees. This would reduce the in-person portion to as little as 20 to 30 minutes when they're able to complete the documentation from the convenience of their own home. Offer letters can be stored in the system and be auto-filled based off the information for the individual potential employees. This also transcends to follow-up and rejection letters for applicants. Currently, we manually have to send emails or send letters via US mail. This would allow a potential employee to set up a profile, and once they apply for the job and interview, if they do not receive the position or so forth, this would automatically notify employees that, we thank you for your interest in the position, but we either chose you or we didn't. It contains COVID vaccination tracking, license and certification tracking, and annual requirements that are required for nursing positions. And then currently we are keeping track of these in multiple different databases from Excel to Word that we pull on a monthly basis to update and see if our employees are in line with the dates that they're required. The system will track necessary dates for employees who are hired and rehired. Not just the most recent hire, but if they have been on board and left and came back, it will have all of their information right there at our fingertips. Information flows throughout the system. There's no need to re-enter in different fields. When an employee is placed in the system, they're automatically loaded to their position control and the organizational chart, along with any pertinent data that is required for those positions. And currently, we keep track of that on multiple different spreadsheets and papers that we change as need be if there's any changes made to those positions. Time cards can be updated by department managers. Alerts will be sent in the form of a reminder if your employees in your department are missing punches, which gives the manager flexibility and authorization to be able to update their specific employees in their department. Currently, those are all being given to Heidi, and Heidi's bombarded with multiple time cards and fixes. So this would also, help Heidi in that aspect of not having to constantly be making changes. It would put that responsibility on the department managers first and foremost. Digital onboarding letters. I said that it has a mobile app with geofences that can be set up for the employee, which would set up throughout our hospital. And employees can set up at time of onboarding their accounts, and they would be able to clock in from the facility from their cell phone, which would alleviate some of the traffic that we're having in the hallways with the time clocks. We would still also have the option to do time clocks, but it would give the flexibility for employees to set up a geofence for every employee, and they could only clock in once they're within the hospital facilities from their phone. The mobile app would also allow employees to receive updates for anything that may be going on in the hospital. We can send reminders, updates, upcoming events, that sort of thing that will go directly to their app that they can access from either a desktop computer or their cell phone app. They'll also receive missed punch alerts. So if an employee fails to punch in or punch out, they will receive an alert, which they can respond with their time to a supervisor to be able to update that immediately. And then also will be getting alerts through the app or via email for required and upcoming past due requirements, such as N95 fittings, any type of certifications that are required and things like that. Currently, like I mentioned, this is all manual process. So being able to have something where we can have everything combined into one database would be phenomenal. So those are my things, and I'm going to hand it over to Carrie and let Carrie.
One thing before you switch over, this performance evals. My understanding was the system has the ability to automate that process. Is
It
that
sure
correct?
does. Yes.
Okay. But that would be a huge plus.
Evaluations will also be sent to the managers digitally through this system here, and they can go out and fill them out, and they will automatically send HR a notification letting us know that they've been completed. So it's all inclusive system all in one, where we're alleviating so much paper and tracking those papers down, and it got lost on my desk. There's no excuses. It's going to be right there at your fingertips on your computer to be able to process.
A question. You're not addressing payroll at all. Is this not taking over payroll also?
It is, yes.
Well, you won't be able to evaluate board members.
We can make it work.
We're adding that specifically. We're going to test it on one board member.
That's going to save money in some other areas, it sounds.
I think that it will certainly save a lot of time, which could obviously
Well,
equate to
save
money.
money. What about programs? Payroll.
We don't have really, we basically have nothing for HR right now in terms of the system. We have things, nothing that's used. And in mine and Sarah's opinion, nothing that is a very usable system.
Okay.
CPSI does offer something that we actually do have.
We did a
but
demo
it's
too.
Well, this is even outside of this demo. So there's something in CPSI that exists, but it's really not user-friendly, especially to the scale at which this thing is going to do. So we're taking something that's a complete manual process.
Sounds like we have to have it. What's the cost of it? I'm confused on.
It's going to cost us 42 grand a year
That's it.
per year. So that's
Nothing
an
up front,
ongoing recurring.
nothing-
No, it's $8,400 one-time setup fee to get.
It's about cost of one employee. It sounds like you'd save that much time anyway.
I think you will
And be
save a
more
lot of time.
efficient, and be better for the employees.
I still have a
Just
little.
understand it will cost us more work in payroll.
Pardon me? Because.
There is an increased payroll workload that will come in. Where you are saving the time of all of Sarah's staff, the time of onboarding employees, so that employees' time or new employees' time in onboarding.
How much payroll, how much additional work is payroll?
It's a bi-weekly upload of an Excel spreadsheet.
Oh, okay, you just upload.
Correct.
It's a lot more than that. This is Dave. And Barbara is right. You know, finance is concerned, but we're behind being team players and trying to make it work. But if we're going to present it accurately in terms of pros and cons, there are some risks as it relates to finance and payroll. These kind of things, just for starters, just to get the system on board, they have to have expertise programmers come in and make sure that there are zero mistakes so that everyone gets paid accurately on the conversion of payroll. So that's always a scary moment when you're converting payroll systems, especially that first one.
Real
So
quick, Dave, just so you know, I've been through this with 3 different payroll companies and 3 different companies that I worked for. They have somebody come in and you guys pull your yearly reports and send them all the numbers. They input that number, and prior to becoming active, you run what is called a like a payroll with our own information, but it doesn't affect your numbers. So we're able to pull those reports and compare them with 1 or 2 of their people that work there that actually implement the system and input those data that we send over via Excel spreadsheets or uploads. So I've done it before. It is a lot of work, but once you get it up and going, the actual importing of the spreadsheet doesn't take very long to actually put it into the system and do it.
I'm okay with that, but it's once we get past the conversion stage, I'll feel better about it. But
yeah, I mean, with any project of this magnitude, yes, it's going to require work.
Yeah.
There are hurdles you'll have to jump through. There are things that can go wrong, but overall, it's a.
What it'll do is awesome.
I
So
think so too.
we're behind, and Catherine, I can't see how we cannot send it to consent.
Well, I have a
one-
couple questions.
Yes.
When you're saying it's gonna save HR at least 2 hours per employee, that's a new employee, correct, or all employees?
A new hire, it would save 2 to 3 hours per new employee when we are bringing employees on and onboarding them, but it's going to save countless hours throughout our workflow daily by entering this information into one system instead of entering it into 4 or 5 systems. Currently,
So my next question is, does HR have overtime every pay period?
no, but we also struggle to make sure that we're getting it all done in a timely manner, which is also puts us at risk for liability as far as errors are being made.
So would this replace a full-time person's position and the number of hours saved?
I have talked to Tim about possibly cutting back the girls' hours, cutting back about 5 hours a week per employee. But at that point, he said, we're not quite there yet until we get this all up and going, because we do have such a backlog of multiple years of data that is currently stored in boxes, and we don't have access to that. We're going to be working on uploading all that information and putting it into our system. We've currently done already all terminated employees from this year to current, and we now have all their information digitally stored on our computer system. So the goal is, once this gets up and going, to start with our past employees from the most current to, you know, several years back, to start putting that information in the system, so we're not pulling manually, going through a storage unit of documents when we need them. So this is actually just the beginning of being able to bring the rest of our past years a little more current as well.
There's a savings in this as well. You know, again, the report writing capabilities of the system. Right now, when we want to run reports to find out what's going on in HR or salary changes and those kinds of things, it's all manual. I mean, it's all 100% manual. And like I said, hopefully this system will have, again, because everything is now in one database and so forth, it'll be so much easier for us to query the system for, needed information that we need for making decisions. So that is consideration.
Well, I'm not questioning bringing everything up into this century, and, I have no problems with that. It's just, I kind of want to know, when do you think this would be up and running, and how long do you think it would be before all the other information's input? Because, I mean, if we're looking at saving hours, if this program's going to save hours in HR and probably not in payroll at this time, I mean, are we looking at, as we continue to change and come into this century, are we
We're losing you.
I'm not saying jeopardizing as in we're going to let them go, but anytime we enhance other things, we tend to let people go, and then we get in like, okay, we're doing this, we can do this. Well, then we find out we need that person back to manage the system. So I'm just going to
any of our employees, I don't plan on any of our employees being at jeopardy as far as human resources is concerned. Dunia, I have One of my employees, who's the clerk, is going to be the liaison for this. She's gonna be what we're gonna consider our system trainer. So myself and that other employee will be trained in the system, and I'm gonna have one of my assistants completely trained from top to bottom, where she can actually work with other employees in other departments if there's ever employees that need help with the system, or management and training the other employees. And she's gonna manage this on as her baby. And then my other assistant in human resources is gonna be doing all the functionality of the day-to-day stuff with benefits, beta, workers' compensation, and all those other things that still have to have follow-up and reporting, and EDD, disability, all those different stuff. So as far as that's concerned, it's more about streamlining everything and getting it all into a situation where it's all in one spot and maintaining it.
Tim, you can probably answer better than Tim, but we had an issue with the continuing education a few years ago.
Mhm.
And sort of blowing in the wind. Does that take care of that? Is it pretty accurate, or you know what I'm talking about?
Are you talking about like our LMS program?
The one we fired some people over a few years
So
ago.
that particular.
Oh, that's LMS, and that's a different
Health
department of education.
Totally different. Well, could it be incorporated to make sure that's being run properly?
That
Oh, yeah.
system now is being very well managed.
Okay,
Yeah.
all right, that's,
But
You know,
two separate-
Gene,
okay.
I just wanted to say that listening to this, when I worked for a company a few years ago, and they had a software package, Gusto, and it's exactly HR. So all I did was I downloaded the app, and then I had to onboard. I had to put all my credentials in, all my driver's license, everything, and then they had all the documents that I needed to read, the employee handbook, the safety manual. So everything was on this app. So I just went through, I read everything, I signed that I read, and I acknowledged it, and they received all that information. And Gusto is a similar company where everything's done on an app, and it does save a lot of time. So you don't need to go in and, go through all the paperwork, but it streamlines the onboarding side of it. So it does save quite a lot of time. And then if you want to go back, and even if I wanted to go back and look at my records, I would just go on the app. I would see what I'd signed and when I'd signed it, when I was hired, and so it's all in one. It does make life a lot easier, and you'll probably find that everything takes time to get used to. But
Yeah.
Your tax documents, your I-9, if you want to make any changes to those kind of things, are all able to be done on board.
yeah, you can all do it online.
Then it would be easier to replace Sarah. That way we wouldn't have to train anybody.
No, I find something for Sarah, so you don't.
I want to get back to Catherine's question, and Carrie, from what you know of the system, what are we expecting time-wise for implementation? I mean,
First of the year. First of the year is our intent to be live with this system. So all the preliminary work, as soon as this gets approved by board of directors in a couple of weeks, we will immediately begin work to get all of the background stuff done. Sarah's got a ton of stuff that needs to get put into this system. We need to get employees entered in the system. There's a lot that needs to happen, but the goal is to have it completed by the first of the year.
One other thing I'd like to talk about, just throw out there real quick, is that currently, since I've been here, I have been working diligently to try to update our policies and procedures. And being that I'm new to the healthcare industry, I'm reviewing them and taking them to the board and learning new things as I develop and go through them. And all that stuff would be able to be digitally done on here and be sent out to employees, and update our handbook electronically instead of at district-wide orientation. I sit here at district-wide orientation once a month with the employees that we onboard, going over each individual policy that we update with all the updates and that information. All that stuff can be done digitally, which would technically, for the HR side of it, we wouldn't have to have an HR side of the district-wide orientation. And I know that's kind of nice for multiple people, because, pulling somebody away for
I can't see how
hours.
we could not do it. I mean, it sounds crazy to not have it, because
Are there going to be two systems now, Carrie, that manage
Now,
policies?
There will not. If they need to, if there's something that they need to acknowledge as part of onboarding, they could acknowledge it through this system, but our policy and procedure management software is the one that we are currently beginning to roll out right now. That is not changing with this.
We will direct to that, right?
But this would alleviate district-wide orientation because those policies and procedures, as we're making updates, they can acknowledge them directly either through the LMS and do it through there, or update them directly through the new HRIS system. So then
So-
district-wide orientation would be directly just for Bob showing them around. And so
Catherine?
Yeah, I personally have an issue with taking all the people where you're onboarding and doing your orientation with computers and not live people. I'd rather see the person. Yeah, I can sign everything on there, but I need an introduction. I need to know what you're going to do. How are you going to have my back as an employee?
Yeah.
You know, and you can't, I don't want to see that taken away where it's just, you know, Bob showing people around. I've had those orientations.
they still will be coming into human resources to complete their drug testing and to just go over everything in the system. We'll be able to review it with them and ask them if they have any questions, perform their drug test, send them over to the health department or employee health, to go and have those done. So there still will be interaction with the employees, but instead of 3 hours, we're going to be bringing that down to 30 minutes.
Yeah, sometimes, Catherine, when we still go through our monthly orientation, that would still be a part of the program. There's just not going to be so much time spent on just HR and completion of the forms and those kinds of things. So
Currently, we have
I just want to
22.
make a comment. Again, I absolutely agree that we need to update our systems. This is archaic, especially with the amount of data that they've got to manage down there. Do I have concerns about it? Sure. You know, it's one of those things, like I said, when you get big system installs like that, you've got to watch them very closely and make sure that things are done accurately. And so that we will follow, and we will have processes in place to double check these things as we go. So just
well, and the system's only going to be as good as
The people
the operator.
that is true.
Have in place, yep.
So,
And that's
yeah,
why
I think it's, go ahead.
that's why we're gonna have one dedicated employee who knows the system from front to back and can be a trainer and deal with the employees and all of the onboarding situations so that we're not left behind. And I have 100% confidence in her.
Let me make a comment too right now. The LMS system, when we had problems with it before the education, we found a expert in that LMS system that was looking for a job. We hired her and she has been able to manage that system flawlessly. She even likes to challenge the system administrators at Relias with some challenges that she sees. And so she's at a level that she can actually question the LMS provider, which that has enabled us to really have a good handle on our LMS system, where we didn't have that before.
Oh, thanks, Mark.
I can't give you an exact year of when our handbook was redone, but currently we go over 2011. So we have currently about 22 policies that we go over in district-wide orientation that have had changes to them, and we manually review those changes with every employee that we onboard.
But this will be
This is still,
easier.
we can update it and actually update our handbook
Update.
and have our handbook updated with the policies that are behind and
Catherine, if you want,
review those.
we can put it off till next month.
No, you can send it to consent because you can send it to consent. That's fine. I just see a lot of issues
I agree
with
you.
any program. Not that I'm going to be keeping tabs, but this is a lot of money. And I know it's a lot of equipment and it's going to save people's hours and stuff like that. But I just want to make sure if we're saving all those times and hours in departments, then I don't want to see paying overtime for somebody else that's having to do something. So, and if there's a problem with payroll, payroll's you don't want to mess with payroll, in my opinion.
Right.
Great.
Don't
So,
worry about
no,
payroll.
you can send it to consent because I'm just one board member and I can see many benefits to this. But for some reason I don't know, I'm just very cautious about it. Don't ask me why. Sometimes I just have those feelings, but send it to consent. And we'll watch and see what happens. But I don't know, something's weird to me about this and I don't know what it is. So,
Okay, well,
but
we'll
I
have
wanted to
time
bring it
look
up
at
here.
before the board meeting, hopefully. And
And if anybody would like a demo, I know they're more than happy to sit down and do a demo and explain some of the things too. But if we do hold off for another month, we would not make our deadline for the beginning of the year.
okay, we'll send it to consent and
If you want to do a demo, just let me know what your schedules look like and I'm happy to set that up.
okay. Did you hear what she said? She'd be.
I did. Thank you.
Okay.
Thank you, Sarah.
Right, so we'll go ahead and send that to consent. And, okay, you're next on, Dave, on the Carrie's thing, is that what it is? Or am I next?
I think it's the budget.
Okay, page 60, Dave. Okay.
Here we go. Okay, so can you see that?
Well, the stuff's on the bottom.
And it's on the last page of your packet too, Gene. It might be easier for you to see.
No, I can see it, but whenever you turn them upside down and everything, does that disturb their computers?
What are we talking about?
When she moves them around?
Oh, no. That's just
Okay,
what we see.
that's,
We can even minimize that if you don't want to look at them.
it's easier not to look at them, to be honest.
Just a little minimize.
Talking about me, Gene?
This
One
one,
more.
this one.
All right.
I lost everything here.
Do we want to go over this line by line, what they are?
No, I just wanted to summarize. So you have one column that shows the type of IT expense, whether it's software, a license fee, a service for IT, a subscription. So there's a lot of different pieces that are required in any hospital in the various departments and all the functionality that's required. Each of them carries a cost. What we decided to do is trend those costs over 3 years to see how we were performing. And I just messed my spot up. The summary of the increase shows that we've been behind on IT. Our expenses 3 years ago, 335, actually, we came down from that number the last 2 years. Now we're trying to do some catch up this year. So the board is getting a lot of these requests that Sarah did today, showing that we're adding 15.4% more to our IT budget this year to perhaps get us into the 21st century. What we wanted to do is compare all these costs to how other critical access hospitals spend money on IT. So there are statistics out there for IT costs as a percentage of expenses. The industry average for smaller hospitals, doesn't say critical access, but smaller hospitals is 3.3% of the total expenses that on average they spend on IT. We were at 2.08 and now we're up to 2.75. So we're still a little bit behind compared to the average hospital on how much we've been spending for a good reason. Back 2, 3, 4, 5 years ago, we knew we couldn't afford all that. But you know, the amount we approved today, that 42,000, obviously is a big part of the increase going from 320 to 421 for this year is the higher costs that we're now looking at approving for the new HR system. The only other thing I wanted to say, so that for all the other expenses, you know, when we look at our overall goal hospital-wide, we can only afford to approve in the budget is 4.17% higher expenses this year than last year. IT is spending 15.4%, and rightfully so, because there is some catch-up required because we really haven't spent the money in terms of the recent last couple of years in comparison to what is spent at this hospital and also at other hospitals. There is a little bit of a danger when you get what I call best of breed products, which when you sit down and describe all the functionality, it's very impressive of everything you're going to get, but you still have to ask the question as a board member, can we afford it? I'm not saying we can't afford the 42,000, but there is potential as other departments like HR come forward. There's ER, there's med surge. What we're currently spending on those EHR products is about 300,000 a year. There are best of breed products out there, and I just came from a hospital that we went from like 700,000 to 3.3 million in EHR annual costs. If you really get the best of breed on helping the physician make the right decisions at the bedside as it relates to ER and med surge, there's a lot of sophisticated products out there. They're very costly, but you still have to ask the question as a board member of a small hospital, whether or not that's feasible of what you can afford to have. I think we're in good shape right now because we haven't made those big ticket decisions yet. This 42,000 is fine. It fits in to our budget. It fits into our comparison when we look at how much we're spending compared to what other hospitals are spending as a percentage of total expenses. But I did want to kind of give you a flavor of how I look at the organization and the type of decision-making process you have to go through to make those decisions.
Yeah, when we installed the EHR system a number of years ago, you know, those are things that we had the ability to look at those systems as well. Obviously, you know, Chet was a part of that team as well. And, you know, we basically decided, hey, we need to look at systems that are systems we can afford. And then from there, make the best decisions of those that we could handle, especially with our finances at that time. And so knowing that the systems would continue to evolve over time. So, yeah, I mean, yes, there are tremendously more complicated systems out there, Cerner, you know, Epic, these kinds of things. But yeah, I mean, it's the cost to us would be dramatically more money than we're currently paying.
It's kind of a moot point because we have no intentions of changing from CPSI.
Yeah.
Right,
So,
exactly.
But those
That's to talk about a big change, yeah.
Yeah, one of the reasons I wanted to look at this as a whole, on IT, GeoLinks, when we started, what did we start at, 22,000? Am I looking right? It's 100 and
I don't think you're looking right.
GeoLinks.
I know one of the expenses that are higher was a result of us getting rid of the cost of our phone system. So
Right.
that was a trade-off where we actually saved money.
Yes, exactly.
Yeah. So that GeoLinks, Gene, that you're talking about in those first couple of years there, as you saw that gradual increase in 2020, we were only using GeoLinks for our internet service here at the hospital. In 2021, we began to roll out the voice over IP service. That's why you saw a slight increase. And now at this point and going forward, it's all of our internet and phones. So all of our phones with Frontier, who we previously had, that cost is completely eliminated, and it's all into one company.
Are they still, now the internet, we got no choice. They're the best that we could get.
Yeah.
But with voiceover, is that something
Yeah, it's all fine. Voice over IP is a service. If we did decide to change at some point, we could do that. We're not relying upon GeoLinks for that service. We could shop around, but at the time, that's the best service that we could get.
MediaCom?
Yeah.
That's the worst. I stayed in there for 21 days.
Mhm.
That TV sucks. I won't complain. Everything was awesome. And I don't need to watch TV anyway. But is there any way, is it skilled nursing better or worse?
The way it works, and we've done a lot of improvements to the cable TV service, we found horribly messed up cables and amplifiers and all these things that allow for cable TV in a building this size to kind of happen.
Yeah,
And so that's been a big project that's for the most part complete now, to stabilize and improve the quality of that TV
well,
service.
now that with Bluetooth and with, what do you call it whenever you don't have to have the cable?
Sure, like streaming services.
Yeah, do we have that? Is that,
We do not have that. That's a big deal because of a couple things. Number one would be the bandwidth that it would require. So if we have 45, 50, 60 skilled nursing residents over there utilizing a streaming service, the bandwidth that would use could very much hurt us to be able to do the things that we need to do to operate because people are watching TV. Secondly, would be that those are, for the most part, individual accounts. And so you would have to, there's no group Netflix account, right? So there's no way to really manage that well because that individual would have to.
I know our problem. If we were in Bakersfield, we could give them a local challenge and go on the light. You know, wouldn't cost anything. They could just use the antennas on their TVs. Here, everyone's aware we don't have that. But at any rate, you're keeping in mind, we need to do the best we can, especially the patients in skilled nursing, because they can't get up and leave.
That's true.
And so, but anyway, okay. That's a good report, shows everything, and it's awesome. Thank you very much for, could we do that like once a year or once in a
Well,
while?
this is important to note that this is a draft of this report. So there are things on here that we need to dive in a little bit deeper. And so it's a draft right now. Things are going to change. So this isn't the final product.
Okay, cool.
This just gives you an idea of
Yeah.
where the majority of these
Yeah.
expenses are.
It's often, but it allowed me to look at a few things that I had questions on, and you answered them.
Yeah,
Awesome.
Carrie's right. This is a draft, and we tried to turn it around in a timely way. I was going to add one more element to this, and I may in the future is give the board a whole laundry list of upcoming projects so that when you're looking at one project, you can put it in the context of everything else that's coming down the road, all the other departments asking for IT equipment, those kind of things, so that you can get a general feel for how much of a demand it's going to have on the budgeted, the total dollars available. So, you know, if the more we can do that for the board, then it helps you make better decisions as each opportunity comes up.
And I do want to add that there's been a lot of projects lately because a lot of things kind of hit at the beginning of our fiscal year. Those projects, there are a few more that's going to happen throughout the year outside of what, you know, we've already discussed in different board meetings, but they are going to taper off. Like we had several big ones that were all kind of hitting at the beginning of the year to meet timelines and stuff like that. And that's not going to be the plan to continue something like that, where every month we're introducing a new system or something like that. We just had a lot hit right away.
You guys, as far as I'm concerned, you're doing awesome. Now I can see better. And the rest of the board, hopefully it'll benefit us looking at. So we don't need to do anything on that. Thank you for making it.
You're welcome. I'm glad I did it because I learned a lot going through all this detail too. I wouldn't want Carrie's job.
Well, Carrie said.
I had Carrie's job. I know what it's about. It's tough.
Anyway, Carrie, thank you guys. Okay, I guess the last thing is on me. And you've heard me, everyone that's in here now has heard me say this before. We might get that million too, and we might not. We still have employees, even the government saying, well, we should give $2,000 to everybody because their life is hard. Used to, I'd go to and get a steak for $20 or whatever. Now it's $40. And so I don't go to the restaurant, but I still got to eat. So I go to the grocery store and it's 25 or 30% more. And our employees, especially the lower income, you know, you might not see them, you don't go home with them, but they're having problems. There's no way that they can lose 25% of the income and not have problems. So what I would like to see Dave prepare for the next meeting, the board meeting, is something like, it would be equivalent, roughly $2,000, $400 a month or $375 a month for everybody equally, and let the board look at it and vote on it. If you could do that, some numbers, and see what it would cost us. And I think our employees, things can be so much different in 6 months. We could have stagflation, deflation. We could be overpaying our employees and try to not pay them. But right now, it would pay us to help them. Whether money, if we get the $1.2 million, then we've got to pay it back.
I agree. I think, something reasonable like a 2,000 per employee, that's a 400,000 line item that you could ask the question, is that something that we could willing to take a risk on, whether or not we know for sure we're going to get this grant or this new this COVID employee retention credit. I agree. I think we can probably take that chance so that we can do this in a timely way. I tried pushing her on the phone today. She said probably ballpark 2 to 3 weeks before we'll know 100% for sure that the money's in, but I agree, we can keep moving forward to coming up with a detailed plan on how we can help the employees out.
Could you do that for the board meeting? And our employees, I'm telling you, they're awesome. But we need to show them that we're.
And then we could still, based on how things turn out, we could have a second program on top of that if we end up with more money.
Exactly right. Cool. Thank you so much. That's all I've got. Catherine, do you have anything?
I do not have anything,
Sorry.
but maybe the 340B program will help pay for the new computer system.
There you go.
I like that.
Yeah,
I don't promise anything, but I have a feeling it will. You just
perfect.
It's
We
all on Suda.
appreciate that.
One last question. You agreed to sell me half of your accent, but you didn't tell me how much.
Oh, I'll have to tell you in private because you might fall off your seat. So
Oh, okay. Thank you so much. It was nice.
Thanks, Tiffany.
We want you to present something at every meeting because we love that accent.
okay, you know something? What we'll do from now on, I'll read Pride and Prejudice for you for the first 10
Perfect.
How about that? For Jane
Perfect.
Austen, yes, for the Bronte sisters.
And try to make the meetings. It's nice having you here.
You're more than welcome. Thank you. It's a pleasure being here. I appreciate
Thank
you.
you.
Thank you, everyone.
We're adjourned.
Okay.
Thank you very much.
Bye-bye.
Thank you.
Bye, guys.
Bye.
Yeah, so,